Where do you want them to stand? Slowly. The parade. I didn't see the parade.
But we can form one. We can form one.
Yes. Now.
Yes.
Today, besides offering ambulance services, I'm glad to note that we are now offering various pre-hospital care related issues, training courses with a mission to ensure that Kenya attains a first aid skilled person per household. This is a mission St. John Ambulance has never stopped nor deviated from, but instead has grown it, making this service to humanity much more meaningful to those suffering and in need of emergency care. We are geared towards alleviating pain and suffering of any person whenever they are, anytime. Your Excellency, Mr. President, St. John Ambulance Kenya runs a successful network of 34,000 volunteers groups across the country with boys and girls, men and women who have dedicated their lives all through their young age, through teenage and adulthood, serving St. John Ambulances as volunteers.
St. John Ambulance has trained over 40,000 first aid responders. And this will form an army together with our community health promoters to work within the communities in our bottom-up economic transformation agenda to ensure that they promote health and that we move away from the curative services that we have been focusing for many years. St. John Ambulance plays a critical role in the health of this country. They provide emergency services. And that is what makes a difference between when an accident occurs and when the patient is restored. So I'm indeed happy to report to you that since we came into government, we have been working very closely together. And Your Excellency, we now have a tripartite memorandum of understanding between the St. John Ambulance, the Kenya Medical Training College, and the Ministry of Health, where they are working together to train a number of St. John Ambulance people to be able to carry out their practice as first responders.
There is a lot of individualism. There is a lot of selfishness out there. And that most people are looking out just for themselves. And that the values of selflessness and service to others has become very remote. The existence of the St. John's Ambulance and over 26,000 volunteers breathes some fresh air to us as a nation that there are indeed people out there who want to look out for others, for the good of others. I want to say to all of you, congratulations for being part of that team. We are developing a comprehensive architecture for health financing, including emergency medical fund to enhance access to emergency medical care for Kenyans, irrespective of their social status. I applaud St. John for the leadership and commitment to supplement government efforts in provision of emergency and pre-hospital medical service to Kenyans during emergencies and disaster, including when we had COVID-19 pandemic. Your gallant services have saved thousands of lives, and I thank you on behalf of very many grateful people who are beneficiaries of the services offered by St. John. I am also pleased to hear that we share a belief in empowerment from the grassroots. I am pleased to learn that your target to ensure every household in Kenya has an individual who is trained in first aid across the country becomes a reality. This is actually bottom-up in full effect. I acknowledge your contribution to both the emergency medical care policy and the emergency medical care strategy. Your input in making sure that we have a policy framework that ensures that the country is seized with the matter of emergency medical care is a huge contribution that you have made. We intend to build on it as we work on a new legislative framework and policy framework that we are currently developing that is going to take us to enacting 5 different laws, I think, maybe 6. We are working with the county governments so that we can deliver not just on health in general, but also emergency and pre-hospital medical service to the people of Kenya whenever they need it. If you can feel pain, you are alive. But if you can feel the pain of others, then you are a human being. And I think St. John's embodies those who feel for the pain of others, and they step forward to do something about it, to help in situations that are of an emergency nature, situations that otherwise could lead into loss of life. And I want to say to all of you, congratulations. You have our support as you bring up the children. The dolphin are 6 to 12, right? And I see many of them here. That is very good training. This occasion is a commemoration of St. John's Day, a celebration of the milestones and achievements of this organization, and a chance for all of us, including me, to rededicate ourselves to the values and goals of St. John Ambulance in Kenya. Today, I commemorate this day with you, an honor that I accept with humility and respond to you with a genuine eagerness to support you and to strengthen emergency and pre-hospital care in Kenya through the individual and collective contribution of this great St. John's Army that I see. We will work together to make sure that St. John's is on a very sound footing so that you can continue to do the good that you're doing. Training these young people, the young people of Kenya, to be volunteers. Volunteering means you can be gracious, you can be magnanimous with what you have. If it is skills, if it is something you can do for a fellow human being, in especially an emergency situation, it is something that you can offer. So continue to do that for the people of Kenya and to all people in need.